Hi guys, welcome back. So first of all, don't get carried away by the thumbnail. I'm not going to expose something really sensational. So this is not about sensationalism, but certainly an exam is over and there were significant changes in the exams that have a bearing on how the next batch should prepare for the upcoming FMGE exam and for that matter other MCQ based exams. So that's why I wanted to connect live with all of you so that we can discuss the way forward, because everything is changing, right? The change is the only constant, as we say. So even the exam patterns are changing. So let us analyze what changed in the recently concluded FMGE Jan 2026 exam and what are the messages hidden in this exam for the upcoming batches. So how the new generation of students should prepare. Okay, now we have spoken to plenty of students who gave the exam and we have their opinion, and I have discussed with other faculty members, even faculty members from other platforms. So we have an opinion about how this exam was conducted, what are the major changes. So let me put that perspective in front of you. So first, did the subject-wise distribution of questions change? Well, probably we can't say so because, NB, every exam, they don't stick to the standard subject-wise distribution that they are supposed to follow. There are always googly subjects. So this time also there were some subjects receiving less attention, some subjects receiving more attention, but that's the usual trend of NB. So there is no deviation from the usual trend. So there was no major change in terms of subject-wise distribution of questions. Then where did we see the real change? Yes, in terms of pattern of questions. We know that there are one-liner questions, there are so-called clinically oriented questions, and there are so-called image-based questions. But what changed this time was the clinically oriented questions, what we call as clinical vignettes. The layers of information, or in simple words, the lines were too much. Not 3-line, 4-line, or a 5-line MCQs. There were 7, 8, 9-line MCQs, which is crazy. And I'm personally not in favor of such questions appearing in the MCQ based exam where they're giving you 1 minute to solve the question. This is really crazy on part of NBE to do that, because it's like exam should test your knowledge, not your time management skills. Of course, someone with an extremely slow mental reflexes should face challenge for a regular exam, but everyone should not be on their toes to somehow move to the next question without even reading this question properly. So if the question paper is designed that way, it's really not good on part of NBE to have done that. So that is one major change we noticed. So we had extremely lengthy questions, and in all probability this may be the norm going forward in all coming examinations. So as a student who is preparing for future exams, you have to increase your reading speed, increase your speed of analyzing information, and also most importantly, when there are 7-8 lines in a question, it's not possible to be completely attentive on every line. It happens that 1 or 2 lines will be missed by our attention. So you have to train your brain to catch the buzzwords so that you get to know this question is talking about which disease, right? So there are some preparation strategies that we can follow. I'll come back to that. But one thing is clear, the recently concluded exam probably had the longest questions so far asked in any medical MCQ based exam so far. Like we had lengthy questions in NEET PG, INI CET, but these long questions were not encountered. So that was one major change we saw. And I personally believe that it was AI driven. You know why? Because if I am a faculty and some university asks me to set a paper for their university assessment or something, I probably won't put effort and energy to create a 8-line or 10-line MCQ. That is not usually encountered in any of Indian exams. Yeah, in certain USMLE or MRCP, PLAB exams, you may have quite lengthy questions, but usually not the norm in Indian exams. So I wouldn't be doing that. So unlikely that some human did that. So I strongly believe that AI did contribute for these extremely lengthy questions. Okay, was there any representation of PYTs and PYQs? Contrary to what many students think that there were no PYQs, sir, there were nothing from PYT. Most of the faculty members who have analyzed students' feedback, believe that there was heavy representation of PYT and PYQ. तो ये disparity क्यों है? Why students think there was not sufficient representation of PYT and PYQs, and why faculty think? There is a reason. So when we analyze the questions, we know that, okay, these are the standard template questions asked. Like if I talk about medicine, one question from valvular heart disease expected. This time also it was there. In fact, more were there. One question on ABG is always expected. This time more were there. But definitely these previous year topics questions were there. One question on pulse or JVP is expected. This time there was a question on pulses based variance. So there was no deviation from PYTs or PYQs. There was heavy representation. But the questions came in a new shape, new form. They came in a new disguise. That's why many students feel they could not relate to the questions. So they feel PYTs and PYQs were underrepresented. But I would consider PYQs and PYTs were well represented. Where things got messed up is probably, I think this is the opinion of many other faculty members also, that probably they took the PYQs or the PYTs and they made them part of the prompt given to the AI to generate the question paper. It's like, let me take a question on mitral stenosis, simple question on mitral stenosis, and then feed it to the AI and ask it to make it a clinically Binet question. And because probably, see, I feel all the messing up happened while giving the prompts to AI, because they should have mentioned that this paper is meant as a screening test and this paper is supposed to be completed in this specified time period. So the time available for each question is only this much. Then probably AI would have created relatively less lengthy questions. But here, unfortunately, that information was not fed to the artificial intelligence, whatever source they used in the prompt. And that's why it just expanded question like anything. And that's why probably we ended up with extremely lengthy questions. But PYTs and PYQs remain important. At least in this exam, they were well represented, right? So I have a strong belief that AI had played an important role in generating the question paper. And am I against it or am I in favor of it? To be very frank, I am strongly in favor of AI setting up the paper and not humans. Because when humans set up the paper, human personality comes between what should be questioned or what should be tested and what should not be. Because like if I ask someone who believes that every medical student should know everything available in the standard book, such professors are there, they will try to keep the question paper extremely difficult, asking you rare information, rare findings. And at the same time, if I give it to a very jovial professor to set a paper, he will set very simple, easy question paper. So human personalities do influence how a question paper is set. But if you have an artificial intelligence and we have a standard framework created, like there should be these many questions from these many subjects, the question paper should have, this is the difficulty standard that we are expecting, clearly prompting the AI that it is meant for a screening test, it is meant for a competitive examination, it is meant for an undergraduate student. So when prompt is specified, AI can generate well-structured questions suitable for that particular category. FMGE screening exam, so if AI is told that it is meant for a screening exam, not a competitive exam, so it would have created an appropriate question paper. If it is told that it is meant for a competitive exam, it could have created an appropriate question paper. At the same time, if AI is told that the time available for solving these questions is this much, according to that, the length of the questions would be decided by the AI source. So if the right prompts are given and a structured framework is created for the exam, AI can generate much better question paper than humans. So if AI was generally used, I would consider this as a step in the right direction. But only thing is, this time I personally consider this was a messed up paper. Maybe probably the prompt given to the AI were random. It's like, okay, just create a question paper of these many questions and please use these previous year topics or previous year questions. So it's a simple prompt but not adequate prompt. So AI would have created lengthy questions. But if AI has started playing a role, well and good, because AI has already started playing a role in everything, including your answer sheets. I know you get notes from the AI and then replicate that in your prof exams. So it's a welcome change according to me. I am not against it. But going forward, I want whoever is a responsible authority framing exam papers, they should keep in mind, or at least tell the AI the realistic exam structure. They should tell that this is an FMGE screening exam. This is not a NEET PG exam or INICT to the AI. They should tell that please represent all the subjects according to the framework. So get, like, if the NB wants 25 questions from medicine, tell the AI that I want 25 questions from medicine, so that it stays within that framework. Please tell the AI that you want clinical vignette questions, but the length should be designed in a way that it can be solved in the time available for the FMG students. So if that was done, this could have been a much better paper. And I strongly believe that, like, let me make a statement. Assessment drives learning. It's a very, very important statement. Whoever is sitting in a decision making position should know this statement. What board starts asking in the exam is what students start studying. And if board starts asking some rare stuff, students start studying rare stuff. It's as simple as that, because learning is always driven by how they are assessed. Like, if I want to be a dancer, then of course I will learn the dance moves that were likely to be liked by the audience. So audience decide what kind of dance I learn, right? So same way, exam decides what students learn. And it's a responsible position for the leadership who is at the helm of boards. They design an exam. If they start testing the diseases, if they start asking questions about the diseases which are really relevant to Indian society, like diabetes, hypertension, heart failure, ischemic heart disease, obesity, preeclampsia, pregnancy-induced hypertension, gestational diabetes mellitus, tuberculosis, HIV, malaria, if they start asking questions on the diseases which are relevant for Indian population, students will study about those diseases more. But if the exam starts asking about some rare syndromes, some rare triads, just because they are all fancy names or fancy terms, the students will start by hearting that only. So literally, exam can ruin the doctor's skills, or it can build. And unfortunately, over last several years, I have seen a deterioration in the standard of question papers, and because of that, I've seen a deterioration in the quality of doctors that we are producing, because we're asking them all rare syndromes, rare biochemical processes, ignoring the common ones. So today our doctors can't treat simple fever. They're not able to diagnose. They call seniors and ask, sir, my cousin has fever from last 4 days, taken some antibiotic, taken some paracetamol, it is still not settling, what do I do? Fever, they are not able to evaluate, because questions on basic evaluation of fever, basic antibiotic prescription are not asked. Questions are asked about rare infections. Questions are asked about rare diseases. Many doctors today, MBBS completed, they are not able to treat hypertension effectively. They are not able to manage diabetes effectively. They call and ask, sir, HbA1c is 7.8. I had started this particular drug, but still not coming down. What do I do next? And I really feel sorry for this state. And I don't want to blame the students at all for this, because it's not their mistake. Because they know, if in my final MBBS, if I study how to titrate the medications to control the diabetes, or how to increase or decrease the doses of antihypertensives, I know they are not going to be asked in my NEET PG exam. In my NEET PG exam, they will ask about renal artery stenosis, hyperaldosteronism, right? Cushing syndrome. So rather, those relatively less common diseases I will concentrate on. So then I become loaded with information but not with skills. So I become a substandard doctor. Indirectly, who is responsible? The authority which designs the exam paper. So that's why I feel the exam is not fully in the right direction. So if the board has decided to integrate AI into framing the questions, it is the right time for the NBE to sit, introspect, and be responsible. They should know that the kind of exam they design today will influence the kind of studies that our students are going to do. So if they start giving weightage to the right diseases, right topics, right subjects, right systems in a proportionate manner, also being humane and not brutal on the medical students, including the FMGE graduates, keeping in mind that this is a screening test, and the question they should be able to complete those questions in the given time frame. Because when I go through some of the recalls, the lengthy questions, even I struggle to complete them in 1 minute. With 15 post PG years of experience, practice knowledge, teaching knowledge, I still take time to complete, because human reading has a limit. It is not infinitely speed. So all these factors should be taken into account by the NB, so that at least the future batches are not burdened with a irrationally lengthy exam, right? So that is what I wanted to convey today. Now going forward, for those students, okay, I strongly believe now that AI is going to be the future of all the upcoming exam papers. I just hope that board designs a better pro forma for the exam, so that the future exams will be in the right direction, but certainly they are going to be AI generated. So then what is the learning message? How do I prepare for the upcoming examination looking at the changes that have happened today? Okay, so the first suggestion is, if board does not change their modus operandi, they'll continue to do the same way, then the next question papers will also be lengthy, 10, 12. You never know how many lines the AI is going to insert into one simple clinical minute question. So you have to increase your reading speed, right? So you have to increase your reading speed. How do we increase reading speed? By reading more and more frequently, right? And start reading by glancing rather than reading word by word. Try to like train your nervous system or brain to make out a sentence by just quickly glancing at few words. We can train it by doing it frequently, right? That is one thing. Then second suggestion is, please train your brains and eyes to pick up the buzzwords. So you don't have to read an entire sentence or entire question to understand which disease this particular question is talking about. Like, just to give you an example, there's a lengthy 10-line question, but then quickly my eyeballs catch that it is talking about opening snap and mid-diastolic murmur. Okay, so now I know it is either about mitral stenosis or tricuspid stenosis. So my eyes will now look for some additional clue to differentiate between tricuspid stenosis and mitral stenosis, and once that is done, I know it is either MS or TS. Now the whole 10 line is not required, like a 30-year-old female presented with, these were the symptoms, this, investigation done, ECG showed, echo showed. See, when the questions are more than 3 line, they will have lot of vestigial information, unnecessary information. ECG done, it was normal. It may not be contributory to the diagnosis in that particular question, but AI or humans are just inserting it to kill your time. So train your brain to identify the buzzword so that we can quickly make up your mind what is this disease that this question is talking about. So when you start practicing doing that in your regular on your Q banks or question books, many times you are not able to reach the diagnosis, you get stuck, then take time, read, but you're training your brain to pick up the buzzwords. So pick up the buzzwords. Third suggestion is use AI. So don't shy away from using AI. Integrate AI in your every phase of preparation. In making notes, in creating MCQs, in even identifying the important topics and important MCQ points, use AI. Either have a subscription to ChatGPT or Perplexity or any of the AI tools that you are aligned with. Use them, integrate them in your practice, because AI is here to stay. It's definitely not going to go away. So what you can do, so use AI to make notes. What notes, you might ask? So you already have a preparation source. It could be your college lectures or an app, video lectures, or YouTube, or whatever is your source. And you may be having a already ready-made notes available. Definitely read that. But at the end of it, sometimes you feel like I need a compilation of, like, just to give you an example. Sir has taught me about infective endocarditis in one place. He has taught me about Libman-Sachs endocarditis in another place. Like, it happens, right? There are a lot of teachers who cover segments of information here and there. So everything is there. Now ask the AI to give you a table comparing the infective endocarditis and Libman-Sachs endocarditis and endocarditis in acute rheumatic fever. So it will give you a beautifully summarized table. Now print that and make it part of your regular notes. So AI is helping you compile high yield information quickly. So use that for making such notes, right? And ask AI to identify important MCQ points. I'm sure your teachers are also telling you, but traditionally in the past, the exams were framed by teachers, the medical college professors of central institutes or government medical colleges. So, being a human, I can predict how a professor is likely to think. So, based on that, we as teachers suggest that these are important topics, these are important MCQ points. But now that AI is taking over the place of humans, then the important points and important topics that AI sees as important need not be aligned with my or any of the professor's viewpoint. So AI may be thinking something else as an important point. So in that case, we should also know the AI's perspective of important points. So ask AI for important MCQ points. Every time you complete a topic, like let us say I today completed infective endocarditis only. So then just go to the ChatGPT or Perplexity or Gemini and ask it, please make a list of important MCQ points or pearls for the NEET PG exam. So tell the AI what exam you're particularly preparing for. Is it INICT, FMGE, Final Prof, or your NEET PG? And according to that, it might list few important points. Glance through them, and if those important points are not part of your notes, write it down in your current notes. So that enhances and makes your notes AI proof. So whether a professor frames a question paper or the AI frames, you're aligned, you're not missing out on anything, right? So use the AI for that. Third, ask the AI to form MCQs, but please learn the act of prompting. Don't be like the government officials who create messed up papers. So when you're giving a prompt to the AI to generate a question set of questions, MCQs for you, please make sure that you mention what is the target exam, whether it is for FMGE or NEET PG or NEET SS, what is the target exam, what kind of questions you want, or a mix of questions you want. Like if you want 10 questions on infective endocarditis, mention I want 10 MCQs on infective endocarditis with four options and one correct answer, and please align it with the NEET PG pattern. Make sure out of the 10 questions, 2 are image based questions, 3 are clinical minutes, and remaining are one liners. So when you give more detailed prompt to the AI, it generates much better MCQs. People often reach out to me saying that, sir, AI is giving all crappy MCQs because you're not giving them a good prompt. You are giving a crappy prompt, you're getting a crappy output. Give a good prompt, you get a good output, right? So please use the AI sources for notes, important MCQ points, and also creating MCQs, right? That's the third tip. Okay. Fourth tip, important. Do not ignore any subject. Even in the era of AI, do not ignore any subject, because the board may give a crappy prompt to the AI saying that just create a set of 150 MCQs for the FMG from these subjects or from these all subjects. The AI might ignore some subject or overrepresent some other subject until and unless the prompt includes clearly that medicine should have 25, surgery should have 20, OBG should have 35. Until and unless such prompt is given, AI doesn't give a well distributed paper. So just like how NBE traditionally had been doing underrepresenting or overrepresenting some subjects in each paper, even AI might do if the prompting is not right. So please be aware that if you miss some subjects, and for your bad luck, if that subject gets major representation in the question paper, then you will be at a big loss, right? So these are the take home messages for all the students preparing for the upcoming examination. Okay, so I hope we have learned something new today about how the exam is changing, and in the changing phase of examination, how we can realign our preparation strategies. Okay, I'll be connecting through similar YouTube lives more in future. Probably me, Dr. Ranjit, and other faculty members might have few sessions where we will talk about how to use AI for generating MCQs or notes or clinically important points, right? So that's it from me today. Let me see if I have missed any of your queries. Okay. I'm doing good, guys. I'm doing good. Alamurthy, yeah, I do agree the medicine question papers were tough. The reason they were tough is not because they were tough topics or tough information. They were made unnecessarily lengthy, and many students who are not used to such long questions, they got distracted and they could not consolidate the buzzwords or key points. And that's why I'm telling you today, the best thing is if you are preparing for the subsequent examinations, train your brain to pick up the buzzwords. So every time you complete reading a topic, let us say I completed Prince Metals angina, ask yourself what are the buzzwords. Like if these words appear in the question, I know examiner is talking about Prince Metals angina. So what are the buzzwords for Prince Metals angina? Angina, especially early mornings, which does not show an occluded coronary artery on angiography. So you have angina symptoms, but coronary arteries are not occluded. So that's like a buzzword pointing towards Prince Metals angina. Or if coronary vasospasm word appears, then you know it is talking about Prince Metals angina. Yeah, see, medicine motivation, that's where I have a strong, like very strong feelings about it, because I already made a statement saying that assessment drives the learning. So if the exam paper is well structured, then students study accordingly and they become better doctors. If exam structure is haphazard, students also study according to them what seems important, they study like that. So if some subject is overrepresented or underrepresented, it is really bad on part of the paper setters. And I can't blame the AI, because AI generates what has been told to it to generate. So people who gave the prompt, if they have used AI, they should have given a better prompt asking clear breakdown of questions according to the subjects. But then people sometimes do irresponsible things, or it's like, chalta hai, who will ask us? We are the authority. So that mindset is something that we need to take up and fight against. Hopefully, if students keep raising the voice, someone in the government will hear us and they will start designing a better exam. We are not asking them to make the exam easy. We are only asking them to make it logical, scientific, and well designed. Let it not be haphazard, random, unpredictable. And when they're making an exam, when they're designing an exam, it's a humble request from my side that the boards should focus more on the diseases which are relevant to the country, which have higher prevalence here than some rare information. Asking about, even when they're asking about anatomy, ask about anatomy which is clinically relevant, not something which is not clinically relevant. So the representation of information which is not important for clinical practice should be restricted to less than 20%. 80% of the question should come from the diseases, topics, and information which have relevance to a practicing doctor. And until and unless that happens, our doctors are not going to get trained to be good doctors. They are only going to get trained to pass the MBBS, then get into NEET PG, again then pass the MD, and that trend will continue, right? So let us begin talking about it, a change that is required, a real change that is required in the exam. Hopefully, when many people start talking about it, it will fall on the right ears, and they will hope make changes. I have no idea when the results can be expected. Let's hope that we get the results soon, and everyone, hopefully this time the percentage should, I'm just praying and hoping that the percentage of passing will be better this time. So I'm just ending this session with a lot of hopes, and I'm also making a commitment that from my side I'll keep talking about the real changes that are required in the exam over next few months. And whenever you come across any information from my side or from my team side which is about the exam strategy or exam design, please keep spreading it so that someday it will reach the right people who are having the power to make the policy change, and let us see if we can get a better exam instituted. Okay, so I'm signing off now, guys. I will be coming live again frequently talking about strategy and other things. Till then, have a good time. Bye.